Welcome to another episode of TehachaPod with your hosts, Key Budge and Corey Costello. TehachaPod is another way the city of Tehachapi shares information with our community.
Welcome to another episode of TehachaPod. It's Key Budge, Corey Costello today. Corey, we've got a guest today from Kern Public Health that's going to give us all the latest information on what's going on in this fluid situation of COVID-19 and vaccinations.
Yeah, I mean, we had a big in-depth conversation with Adventist Health about it, which was awesome, I think, and hopefully shed some light for the people that were wondering why they haven't got a phone call back or an email and that kind of stuff. Really kind of let us know the volume that they're dealing with. And so, yeah, the same here with there's a lot of information and a lot of things that are changing. I think it's important to let folks know that the system is ever evolving as the vaccine gets rolled out.
Well, let's welcome in Michelle Corson. You are the Public Relations Officer, our Public Information Officer for Kern County Public Health. Welcome to TehachaPod.
Hi, I am thrilled to be here.
We appreciate
Thank
the
you
fact
for having me.
We appreciate you taking the time. We know how busy you've been over the past year.
Yeah,
and it's probably an understatement. Well, we've got an ever-evolving situation with COVID-19. We've got vaccinations that are rolling out. Tell us about Kern County Public Health's perspective on what's going on and what information we need to get disseminated out to the public.
Yes, we have been waiting for this. The vaccines are here and they are being distributed. And this is the point during a pandemic that, frankly, us in public health, we wait for this moment, right? We want it to move as fast as possible as things roll out. This is a novel disease. These are new vaccines. So we have to do this slowly. And what I mean by that is with this new vaccine, it's coming in slowly. The allotments that our county gets, as well as the rest of California, is based on what the state gets. And we can't get enough fast enough to meet the demand. We are really starting to see our residents say, I'm ready. If you meet the current qualifications, which is set by the state. So that means if you're in that tier 1A, you're in the healthcare, some of our first responders. And now the big one was when they opened it up 65 and older. So if you're one of those qualifying groups and you want to get vaccinated, which we hope you do, well, how do I go find a place to get vaccinated? What does that look like? And that is a situation that is continually evolving and growing. And I know there's been a bit of confusion. We're growing how many providers we have. We are very excited for us. It's not in Tehachapi, but here in Bakersfield, just down the road, we're opening a mass vaccination site at the Kern County Fairgrounds. And we are thrilled for that. And we want all of our county residents to know that is going to be something that they can access.
One thing I've heard on social media is people have been looking forward to this fairgrounds rollout. It's been anticipated. There's been a lot of talk about it. Now, the website, kernpublichealth.com, they go to the website, they click on COVID-19 vaccination locations. You've got a map that pops up. And
yes.
Tell us a little bit about that and how people can get that information about maybe something that they can find local for them, or if it may be during work. Tell us about that, the website and how it's informative for the community.
Yes, we built this website just the same as we did for our testing locations for COVID. So yeah, you come to kernpublichealth.com. There's many ways you can get to this interactive map, but we've put it right on the home page. It says find a COVID-19 vaccination location. You click on it. There's many ways to use this map, but essentially you can put in your address and it's going to show you the closest vaccination locations to you. Then you can expand, you can make a list view. There's all kinds of things you can do with it. The list is growing and changing and we update it regularly. We update it though, based upon the information our local providers are giving to us. So that's really important, but it's good information we're getting. Currently, the fairgrounds location is not on that map because we're only in a soft launch phase this week. However, we will be notifying the community by this weekend what it's going to look like when we open it up to the public, how many we can serve every day, and how you can make an appointment. So that's coming, but the fairgrounds will be on that map when it's open, and you'll be able to click on it, and it's going to show you how to register. So really always visiting our website is the key to knowing the latest information on COVID-19 and all the vaccinations and testing, et cetera.
And I think what makes this a little bit different, Michelle, and pointing out the importance and really the requirement of an appointment. I know Josh Pierce from Adventist Health, when we talked to him, was mentioning the line that the public health has been sort of telling the care providers, look, you don't want somebody getting COVID standing in line to get a COVID vaccine. So you don't want, I mean, it can't be like cattle, right, where everybody lines up and it's just give them a quick shot and you move on. The appointments actually are important for a variety of reasons, but one of those being so you don't have thousands of people waiting in line for this, this inoculation.
Absolutely. Maintaining that social distancing, knowing that when you come to a vaccination site, you are going to be in a safe environment. This is very important for our residents to know that there are protocols in place for these vaccinations to happen. And they should expect that. They should expect a safe environment. This should be taken seriously. And we have phenomenal community partners. Adventist Health is fantastic. And the other component that we've had to consider in this vaccination for COVID-19 that is unique, there is an observation period, which is fantastic for our safety, right? Even though adverse reactions are minimal and the safety behind these vaccines is powerful, you still are going to have that 15 minutes of observation, 30 minutes if you have a potential adverse reaction because of the survey you are going to be completing if you've ever had an allergic reaction, for example. And then you're going to be watched by medical personnel. I find that comforting. I think that's a great thing that our residents know is part of this COVID-19 vaccine that you don't necessarily have for like an influenza vaccine.
Each of these different sites that we go onto the website and we pick the dot that's in the location. So when we've looked at the Tehachapi Valley or Adventist Health Tehachapi Valley Hospital, they had a form that you could fill out. Now, each site is different, even though the same protocols for safety are in place. Each of the appointment or to get yourself on the list is a little bit different for each location. Is that right?
It absolutely is. All of our providers have had to take the initiative to go to the federal government and say, we want to do vaccinations. They had to qualify on their own for this outside of Kern County Public Health. But within their infrastructures, they've developed their systems that had to adhere to all of those regulations. But yes, everybody's going to have their own way of registering. Some it's a phone call, some you can go online. So I think it's really important for residents to know that that's going to vary from site to site. And that's why we think it's important to put it on our website to try to help you kind of navigate all of that.
Michelle, I'm impressed by the fact that here we are almost a year into this pandemic and you still have the energy that you have. I know your team has been going nonstop for nearly 12 months now. What's that process been like for county public health, given everything that's happened in the last 10 plus months?
I'm not asked that very often. And so thank you. It's been incredible. I am so fortunate. I was born and raised in Kern County. Much of my years have been in Tehachapi. I live in Bakersfield now. But to be public servants in a public health department during a pandemic and to clicking into the roles we have been trained for has been an honor for us. We have changed our department entirely to focus primarily on responding to this pandemic. There are people doing different jobs than they typically would have done. And it is thrilling to be a part of that. And we all love coming to work every day. We've never worked harder than this. But our community should expect that, right? This is what we are here for. We are paid to do this, and it's an honor. But it has been challenging, but it's also been an honor to serve our community. And yeah, you hear the energy in my voice, I think, because it's every day is new and it's thrilling to just be on the front lines and do something to help the community that I love.
How quick was that sort of pivot? Because I know I'm thinking back to probably last January, some of you all showed up to a city council meeting. We're talking about a new initiative to help, check blood pressure and a lot of things for seniors. And you had this whole new course you were going to roll out in Tehachapi. And then, a few weeks later, obviously, before that could happen, COVID-19 hits. And so you all really had to shift from sort of that wellness and a lot of the normal public health duties to the pandemic. How quick was that sort of pivot?
It was immediate. We had to, and that was tough. We had some great initiatives going. Our Waste, Hunger, Not Food program. We had just come up to Tehachapi and you guys were going to embark on that journey with us. We met up there in early February. And then the pandemic hit and we had to quickly, things started shutting down. The stay-at-home orders started coming. We opened what was called our Department Operations Center. So we have an emergency response system in place that we immediately clicked into. And that basically is the old job you did at one point, you're now reassigned. And we all sign up for that, right? But this is the first time in my career that anything like this had happened. So it was immediate. We had an infrastructure. We all clicked right into place. And it's been like that. Our Department Operations Center, as a department, we meet every morning, first thing, to debrief on COVID-19 and the actions we are taking for this community. And that sets our day, and we do it again the next day. So it's been like that since last February.
Now, I know information has been incredibly fluid. This is, as you say, you're debriefing on a daily basis just based on what you guys are seeing. And Kern Public Health is the overseer here for us here in Kern County, but you're getting information from the state level that's mandating changes. And you guys, as Corey says, you're pivoting constantly based on the information that's coming down so quickly that has to be implemented almost immediately.
Yes. And you guys, you've done your homework. You're very astute. But yes, because we follow the state guidelines, and the state is working with the federal, right? And the Centers for Disease Control. So things move so quickly. In a normal world before the pandemic, when we're not in an emergency situation, you've got time to plan, and there's some planning that goes into some of this. Now it's quick. It's a phone call on a Saturday night with the state, not uncommon, because there's going to be something new coming down the pike and our team needs to be ready. Those are the kinds of things that every weekend, it would be rare for us not to get a call and need to get on with our state, which has been phenomenal partners. And we get that information and we start to impart that here in Kern County. So it is a constant communication and flow between your public health department and the state officials.
Maybe some of the challenges that you've seen over the past several months to maybe even back to the beginning, but the challenges that you've seen here within the community that, whether it's knowledge on the individual's behalf, our businesses, this has been such a far-reaching incident that's nonstop. But what are some of the challenges that you're seeing in the community that maybe if we share a little of that information, people can make some adjustments that you're still seeing here, 10 months into this?
Yeah, there are, and it's a year full of course, there's been challenges. This is a deadly pandemic. There is no other way to say it. There are people that have lost their lives and have been hospitalized, and our hospitals are full right now. But it's been an opportunity for me to see the beauty in our community and people coming together and trying to do the right thing to get through these extremely trying times. My heart really feels, first of all, for families that have lost loved ones, and knowing the steps to take to stay safe as possible, right? And knowing just some of those basics of how to wear a mask and why it's important to wear a mask. Wearing a mask is not always fun, and knowing that that's an important thing, and as simple things like washing your hands. It seems so ridiculous to talk about it, but these are some life-saving measures potentially. So I think some of those things, just realizing it's individual actions, everything you do to stay safe, you're impacting your family, your community, and slowing the spread of this disease. And that's a very true statement. Our businesses have really, really suffered. It is heartbreaking. I have talked to businesses. I was on a team for a short while trying to help businesses navigate all of the guidelines that have changed constantly. And it's just such a struggle. So I feel for our businesses and what this has done, the business community. Yet they have stayed strong, but make no mistake, that has surely been a challenge for them and our entire community.
And it seems like, too, there's been lessons learned along the way and things that have gotten improved. I mean, initially at first, it was how cases were reported, and that continued, and then it's shifted. And now, you all have created the online dashboard, which, you probably never thought that many people would visit your website in a single year, but I'm sure the hits are looking good for you on the website. But the dashboard broken down by zip code. I mean, I can look at Tehachapi And I often do, and I see, how many total cases there were, and then how many are active, and then how many are, then basically you can figure out who's active, but how many recovered and how many are presumed recovered. Kind of gives you a sort of a, infection rate, so to speak, of what your community is dealing with. And that's certainly helpful, especially, for the smaller communities that might not have the big impact of what maybe the size of a Bakersfield does. But I think that dashboard is one of those things that slowly grew into what it is now.
Yeah, and there was so much work. We had to build these systems. They weren't in place. We've never tracked a disease like this. We report on valley fever and influenza, but there has never been anything like this. So to have to build these systems from the ground up and develop an infrastructure to keep our residents informed, which they deserve, but that's been a lift for sure. And it's been exciting to see some of the brilliant folks I work with that have been able to kind of put these things together and to maintain that on a daily basis. Because one of the things, and is in the public relations side, I pride myself on the importance of letting our residents have the most current information to navigate this pandemic safely. And with the most information that they deserve on a daily basis is very important. I expect that as a community resident of my public services. So to be in that position to try to make that happen on a daily basis, we just take it really seriously.
With these constant news cycles that we are a part of, getting the information out as quickly as possible helps alleviate the misinformation that seems to want to get spread, and the rumor mill and the social media comments that take over, and all of a sudden, before you know it, something that never occurred is as if it was life to people. And it's amazing with what we've been dealing with, how quickly we have to vet the information and get it out to the community so we can stop the misinformation.
Yeah, this is the biggest story of the year, right? And social media is powerful, and there is a lot of misinformation. And I spend a lot of time trying to put out the factual information that grows and changes on a daily basis too, which is also a challenge. A lot of what we were hearing at the beginning of the pandemic, it's changed now. Some of the protocols and the guidelines, it's an ever changing. So it's difficult to navigate, but seeking that factual information. And that's why on our website, we try to point you to other sources of reliable information just to try to navigate and do the best thing for you and your family.
One thing that we got when we talked to Josh at Adventist Health, Tehachapi Valley, was he was talking about the amount, they were really kind of taken back by the amount of people that were committing to get a vaccination and then no showing or not bothering to cancel. And then it's so critical because of the limited amount of doses. And then there's a certain amount of people that can be taken care of. And then we have no shows, and we don't want to have wasted vaccine.
Yes, that is a challenge with the COVID vaccine. Temperature control is something that often in a vaccine situation we haven't had to deal with like this. And logistically, and to be responsible with all that is in that vial is a challenge. And when you're the one that is administering and doing the right thing by making appointments, these are certainly the challenges that all of our providers have had to navigate. And I know they're learning as they go, and we're all going to get better at this. But yeah, if you make your vaccination appointment and you end up not wanting to go, cancel it. Let them know, because you're going to help someone else that really wants that vaccine. I know there was a lot of information going around with the recent Moderna, the hold on the lot of Moderna out of an abundance of caution. And we just got word last night from the state after their investigation, it is perfectly safe. So all of that Moderna that was being held is now free to be distributed. And it shows the system's working. There are system checks in place, and they held this lot just so they could conduct an investigation for safety. I find that reassuring that there are these safety measures in place, and I hope our residents find that reassuring too.
Do we kind of feel now, I mean, not to get too hopeful, but that maybe we're, knock on wood, the home stretch of this thing, that as the vaccine becomes more and more available, that we could start, because I am hearing that we're, some of the cases are going down, hospitalizations are going down after that last surge. So how much do you think the vaccine is going to help in possibly putting us in the home stretch of this thing?
Oh, we're very optimistic. I think we all should be optimistic. This is what we waited for. This is the path out of a very dark time for us. We believe that. We want it to move as quickly as possible. We want as many of our residents, after doing their research and talking to their doctor if they have a question, but to get the vaccine if you feel safe to do so. We encourage you to. And the more of us that are vaccinated and we start building the immunity that we need as a community, we feel, and we're through the holiday season, we are quite hopeful that we are now going to move into some lower daily case numbers. We are very hopeful. So that's what we're thinking here at Public Health. And we want all of our residents to just hang in there and keep being safe and get that vaccine when it's your turn and you qualify.
Let's give them the information where they can follow Kern Public Health. What social media platforms do you guys like to populate and get the information out directly from you?
So, of course, our website at kernpublichealth.com, but we've also got Twitter, which is very active, and Facebook and Instagram, all Kern County Public Health. You will find us on all of those platforms. And anytime we are now doing media advisories, I'm often now putting that language directly on social media so that our residents can kind of ingest that immediately as well. I did it earlier today about the Moderna decision. I wanted everyone to know that as quickly as possible. But our media partners have been fantastic, and we get them to get the messaging out, Yeah. So, yeah, but please follow us.
Yeah, I think it's important because that's one thing that we've learned. You can put out a press release, but they might grab 10 seconds out of 2 minutes worth of information, and it goes into a story, and that's what time they can allot to us. So yes, we've been utilizing these social medias platforms to get at all of the information, and I know that's what you guys have been doing. So I think it's important that people follow you directly, so they can get it completely.
Maybe one day we'll have a fancy podcast like you guys.
Hey, I tell you, it's where we've evolved to. This has been part of the communication platform. And when you start looking at the audience, the demographics, and how many people from Tehachapi commute, this is where radio has gone. Radio has become podcasts. Mm-hmm. So we're able to catch people in their drive to Bakersfield or the Antelope Valley. And we're seeing people going back and listening to all of our podcasts historically, all the way back to March 2020 when we started, just because the information is relevant. And I think it's a nice way to have it delivered, right into your car with technology today.
I think it's fantastic. You guys do a great job. And aren't you some award winners recently or something? Did I see something like that? Anyway.
Nothing that's been announced.
That's right.
That news made it all the way down here to Bakersfield.
Oh, that's very nice to hear. Well, is there anything else that maybe we didn't talk about that you think would be important? Because we've kept you on a little bit longer than I promised, but is there anything that you think the public needs to know?
I want to thank our public, and I mean that. These have been trying times, and you have been seeking information, and often that's been a bit blurry and difficult as we try to get and ascertain the facts from the state as they quickly have changed, and then deliver that information to you. It hasn't always been smooth, but we are doing our best, and we appreciate our community because Kern County is incredible. I have a special love for Tehachapi, and I just appreciate all of you in Tehachapi for everything you're doing.
Well, thank you, Michelle. This has been Michelle Corson. She is the Public Relations Officer for Kern County Public Health. We thank you for your time, and we hope that you'll join us again on a future episode. Or if there's new information you want to get out, you can always let us know.
Absolutely.
Thank you. You guys have been fun. I appreciate it.
Corey, Michelle was very, very informative on the impact that COVID-19. We know it's been huge. It's been huge on everyone, but their department, my gosh.
Yeah, I think at first, and we've all kind of lived that. Anybody in public service right now has lived this. There's this really weird, there's frustration at the very beginning. I think from the public and even us. I mean, we were frustrated a little bit with the health department at the beginning because but again, it wasn't necessarily their fault. They were getting stuff from the state, but to see how they've reacted and how Michelle and then her boss, Matt Constantine, and that entire team has been able to evolve. And they haven't just, left. They had something that didn't work. They didn't stick with it. They adjusted. And I started thinking about really the amount of work that they've had to put in during this. And it sounds like Michelle's happy to do it and really feels like she's honored to be a part of a team responding to this. And so those are the kind of people you want in charge in a situation like this. So I'm really happy that the County Public Health has done the job that they've done, with COVID-19.
And I think you picked up on her energy,
Yeah.
which was huge. When we had this conversation with Michelle, she was on Zoom.
Yeah.
So we were able to see her and have this face to face, but you could see her.
Oh, you could tell.
Yeah, she was up going. It was like, hey, I've got to get this information out. It's important. And then I've got to get to the next, thing that she's got to take care of regarding this.
Yeah.
It was, I can't know I don't know if I could keep up that pace.
Yeah, you really can't. I mean, it's interesting, because I'll be honest with you, there's been days, in this job, because really that COVID stress, that malaise, that piece in the back of your mind that's there, and it affects everything you do daily, and it changes your job and that sort of stuff. And you're spending time chasing things down a lot. So you'll have those kind of bad days and you really feel like you're beaten down, but you got to answer the bell the next morning and get up and do it again. And you can't let that sort of bleed into, and it's really apparent that public health is not doing that. And it's pretty admirable that they're at that and they continue to come in, because they're honestly, our public health department, they were the same as they were back in March in terms of personnel, people in charge. Look across the state, look across the nation. How many public health directors have resigned because of either mishandling or just the stress of COVID-19? So the fact that this team is still together almost a year later is really impressive, and they're doing something correctly.
It is. And they're a part of the public safety team. They're, and when we look at it, we haven't been able to talk to any nurses or doctors yet because they're so busy.
Yeah.
And we're not going to take their time right now. These guys are the heroes. 2020 belongs to those on the front lines, and that includes all of those nurses and doctors, the hospital staff. But it goes beyond those, and you've got the EMTs and paramedics, law enforcement, the firefighters that are out there dealing with these calls at each household.
Yeah.
But then when we start to dig in and we talk about like the volume of calls, it translates to when people are hearing desperation on the other side or frustration and anger, that it takes a toll on us individually. So I think a big thank you to everyone that's in the medical profession, public safety profession. I appreciate everything that you've done and are doing, and finding this energy is, once we look back, maybe you can write a book on what you did to keep that energy level up, because I think there's some people that need to read it.
Yeah, there's going to be a lot of those. And even as Michelle pointed out, I mean, the vaccine, more is becoming available. And we talked about it with the Adventist Health podcast. Like, just give it some time. There's going to be more doses. You might not get it tomorrow. You might not get it next week, but it's going to get there. Let it ramp up and get there. And so I think it's just going to take a little bit of time to put it out.
And those people are so motivated in flipping back to what Josh had said, Josh Pierce, his staff, they want to go in the cold weather. They're like, no, it's too important to get this. We got to get these vaccinations out. We'll deal with the 30 some degrees and snow that's going to happen in Tehachapi. We're going to go 6 days a week or 7 days a week to make sure that we get through this and they continue to save lives. Mm-hmm. So it's, I don't know, it's, we're removed from it, but we get to see it. And then when we get to see some of these examples of what's going on, it really, it's hard to describe because it's that impactful.
I think there's a certain adrenaline to it because, that's kind of what people like Michelle have trained for. My wife, for example, she works in healthcare. She's, when the vaccines started becoming available, she's already doing math about how many members that she has that meet that threshold. And she says, I'm going to propose, I'm going to work 3 Saturdays a month, and I'm going to be able to get, check the box and get every one of those people vaccinated, and it was just this, but I could see it in her face. Like, it was like, okay, this is go time, and this is my plan. And it was super impressive, and I think we see that now. Every specialty has those moments that they train for. And I think when it comes to healthcare, public health, this is that moment. I mean, a pandemic is the moment. And I think they've adjusted, and they're responding as appropriately as possible, given the current circumstance, and everything could change tomorrow.
Yeah. So big thank you again to everyone that's out there on the front lines, and it's just very much appreciated. Mm-hmm. I'm sure you don't get thanked enough, but just know that, we're taking a moment right now, kind of reflecting and thinking about how tough it is. So thank you. And we want to remind everyone, we want you to go to the website, kernpublichealth.com. Click on the button, find a COVID-19 vaccination locations right in the middle of the page. That'll open up. There'll be a map. Find the area that you're interested in getting a test. Click on one of the dots. Each dot is different. It represents a different location. There's different sign-up ways to sign up for the vaccine. But the protocols, once you get to the site, will all be the same. These are uniform.
Yeah.
So again, kernpublichealth.com, find a COVID-19 vaccination location, and then you can set up your appointment. And if you set up an appointment, make sure you make it.
Yeah, keep it or cancel it, but don't no-show it.
Right, exactly. Again, this has been another one of those episodes that just kind of evolved as we started, talking and having that conversation. So, thanks for taking the time and running over as soon as we got Michelle on the horn, because we were waiting and being fluid for her time schedule.
I've learned one thing in this job, is that there's people behind the positions. And that's with public health, right? You hear the word public health and everybody's kind of using that as kind of dirty talk these days, right? But there's people behind, and to be able, we get to deal with these people, but part of this podcast goal is to bring those people to the forefront. Michelle's a 1987 graduate of Tehachapi, or 1987 graduate of Tehachapi High School. Didn't know that, right?
Yeah.
We do now. She's pretty much a Tehachapi native. But there's people there, and you can sense their passion, and that's really part of a goal of this show. And when you put the people behind the work, it makes a lot more sense, and you feel better about the work being done.
If there's anything that you would like us to talk about, shoot us an email, media@TehachapiCityHall.com. Corey and myself and Greg Garrett, we would love to hear from you. Mm-hmm. Whatever the topic is, we'll look at it, and if it's something we can dive in and find guests to expand upon it, we'll do it.
Yeah, absolutely. It would be even great to throw questions on that email too.
Love that.
Because we can do a show of just answering these questions. What's going on with this? What's going on with that? We get those questions on the street. We answer it to one person who asks us. We would love via email, if someone emails that in, to answer those questions on the show as well. It would be great, and be able to kind of reach more people at once.
That's a great point, because if one person has a question, there's 10 others that have that same question,
Exactly.
and we can help answer that.
For sure.
That's media@TehachapiCityHall.com. We appreciate your time for joining us here on TehachaPod, and we look forward to talking with you again soon.
TehachaPod is a conversation about Tehachapi designed for the people who live here or who would like to know more about this mountaintop community. If you have a question you would like answered, email media@TehachapiCityHall.com. We will try to answer it on a future episode of TehachaPod.